Hey guys, welcome back to DOCSHAALA. So in this video of case-based scenarios, we are going to see about an interesting segment that is mucous membrane pemphigoid. Okay, so let's see what it is. So what is mucous membrane pemphigoid? So as you know, pemphigoid is an autoimmune disease that is characterized by blistering lesions on mucous membranes. Okay, the lesions are blistering and it is an autoimmune disease. So it is also known as cicatricial pemphigoid or oral pemphigoid. So Brunsting pericycatricial pemphigoid is a rare variant of mucous membrane pemphigoid. So it presents with localized crops. So it is like crops of recurrent blisters arise within the utricarial plaques, usually on the head and neck. So the blisters may burst, resulting in blood-crusted plaques or scars. You know what is a plaque, right? The 1 mm tissue that we see. So that is like that. So that is like that, and it is predominantly a disease with the elderly. So peak incidence is around 70 years of age. So it appears to be twice as common in women than in men. Okay, so let's see the signs and symptoms. So signs and symptoms, this mucous membrane pemphigoid involves various organs. So let's see how these organs present themselves in the disease. So here we can see the eye. So how eye presents is there is sensation of grittiness or pain, and there is conjunctivitis, as you can see in the eye here. So there is conjunctivitis, and there is a lesion form, erode, and leave heal to leave a scar tissue. So we can also see a scar tissue there, may lead to impaired vision or blindness. Okay, then mouth. So this is important for us. So blisters form first on gums, then near the that is near the teeth. Then they uh, progress towards the palate, tongue, lips, buccal mucosa, floor of mouth, and ending in the throat. Okay, so there are painful erosions and ulcers. So it makes difficulty to eat. So that leads to weight loss and nutritional deficiencies due to starvations. And lesions occurring in the throat can become life-threatening also. Okay, so how these lesions occur? So you can observe the gums here. So tiny blisters are occurring here in the buccal mucosa also. So this is how the lesion appears. Then coming to skin. So skin. So here you can see. So this is a pemphigoid lesion, mucous membrane pemphigoid lesion. There is the blister, which develops in about 25 to 30% of patients. It may be itchy. So bleeding may occur if traumatized. That is, if a patient disturbs the lesion, then the bleeding may occur. Then nose bleeds after blowing the nose. Then crusting causes discomfort. So genitals, so as you can see in the image, so this is the genitals. So there are painful blisters and erosions. Then the swelling of clitoris, labia, and anus is seen in women, and in penis and anus in males. Okay, so scarring can also lead to severe distortion of these genitalia. So difficulty and pain while passing urine is observed, and adhesions can lead to narrowing or even closure of the vaginal orifice sometimes. Okay. Then coming to the diagnosis. So most of the diagnosis is made through this clinical features only. So that is why when we are suspecting any of such kind, we have to examine eye, mouth, skin at least. So these three features we have to examine at least. It's not regularly that we see genitals. So we appear blisters and scarring, and it is confirmed by biopsy, of course. So biopsy is taken from the appearing lesions. So it often we often take multiple biopsies, that is involving multiple areas. So edge of the blistered or ulcerated tissue is taken, and an additional tissue specimen from the adjacent tissue, like the lesion the lesion is taken for biopsy, whereas the skin or tissue adjacent to it is taken for direct immunofluorescence. So there we can detect immunoglobulins along the basement membrane. Then blood samples may be tested for the skin antibodies by indirect immunofluorescence. Okay. Then treatment. So since it is involving various treatments, so the Treatment is mainly symptomatic. That is, the we go on treating the symptoms. So that is how we can achieve a treatment for the disease. So when it is involving mouth, nose, and skin, what we do, we suggest a regular dental care. And for skin, we suggest topical steroid creams, ointments, or anything. And even for mouth ulcers, also we use ointments or some spit solutions. And intralesional steroid injections are recommended. And topical cyclosporin rinse is also used. Then, when coming to eye, so it is corticosteroid eye drops are recommended, and surgery to release adhesions if any are there. And esophagus, trachea, and larynx, there is we have to advise the patient to go on a soft diet, which is not involving any spices. And topical steroids may be used, and dilation of the structures may be done. When it is coming to genitals, so greasy emollients, just petroleum jelly, should be applied frequently in the affected area. And local ultra potent topical corticosteroid, like colbetasol ointment, can be used. Then estrogen cream for intravaginally, it is used. And you we can use vaginal dilators. So surgery can also be to revive the adhesion, same as that of the of that. Then coming to, it might follow like after surgery, we can use some corticosteroids, ointments, and dilators to prevent recurrence. Okay. Then coming to the systemic therapy. So this is how we treat the lesions symptomatically. But even the patient is undergoing autoimmune, like there is immune suppression that is going on, so we have to treat even that also. So for that, in case of mild disease, we use tetracycline antibiotics such as doxycycline, minocycline, and limicycline. Or less often, colchicine, nicotinamide, salazopirin, and sulfapiridine or sulfamethoxy pyridosine can be used. So for severe disease, we use a combination of systemic corticosteroids, dapsone, and immune suppressive agents like cyclophosphamide, azathioprine, and mycophenolate, methotrexate, cyclosporin, and rituximab can be used. Okay, you can just remember a few of these names. It's not that important, but you have to know what we use. Okay. Then coming to a clinical scenario that we see. So a 37-year-old female patient reported with a complaint of pain in gingiva, burning during urination. Clinical examination shows a patchy distribution of bright red areas involving marginal and attached gingiva. In addition, there was conjunctivitis. What would be your diagnosis? So the options given were ANAG, mucous membrane pemphigoid, lichen planus, and pemphigus. So since the patient uh, is like presenting even with conjunctivitis, okay, so it is most probably towards moving towards the mucous membrane pemphigoid. Okay, and anag or lichen planus or pemphigus, we do not see ocular lesions that prominently. Okay. So if you like our video, you can subscribe to our YouTube channel. You can also follow us on our Instagram handles for more content, like DOCSHAALA for dental content and a DOCSHAALA medical for medical content. The links of which are given in the description below, so you can follow us there, and you can also follow us on Telegram. Thank you.